Hi everyone. The topic of the presentation is Schwarz analysis. So let's get into Schwarz analysis. Schwarz analysis was given by A.M. Schwarz in the year 1961. He basically divided the analysis into craniometry and nathometry. Craniometry is nothing but the evaluation of the skeletal base and profile, whereas the nathometry deals with the dentition. So he did that by dividing the upper part and lower part of the skull using the line or the plane called SPP, which is nothing but spina palate plane. So let us see the planes that are used in the craniometry one by one. The first reference plane will be the anterior cranial base, where the line extends from the nasion point in the anterior region to the sella entrance point in the posterior region. The second reference plane will be the line that is dropped from the point N to the point A, which is the deepest point in the concavity of the upper arch. The third plane is the Frankfurt horizontal, which was given by Simon, that is passing through the orbital and the external auditory meatus. The fourth reference plane is the perpendicular plane, that is a PN plane, which is dropped perpendicular in relation to the Frankfurt horizontal plane from the soft tissue nasion, which is present anterior to the nasion point. The fifth reference plane or the angle is the J angle. The normal inclination between the N perpendicular and the SPP plane is the J angle, and the J angle should be 85 degrees. The next reference is the F angle. The F angle is the angle between the NSE plane and the NA plane. So the angle is 85 degrees, similar to the J angle. So the SPP plane forms an angle of 5 degrees with the NSE plane. So this is the normal feature of a normal skull. Now let's assess the temporomandibular joint. Let's see the picture that is present in the upper right side. You can see there is a continuous line and there is a dotted line. So the continuous line represents the normal position of the skull, whereas the dotted line, you can see that the TMJ is superiorly positioned. In this case, what happens to the angle that is formed by the PN plane and the FH plane is reduced. That is, it is becoming 80 degrees from 90 degrees. In this case, what will happen is the mandible will be posteriorly positioned and the patient will have a dolichocephalic facial form. Similarly, when you see the picture that is present on the lower right side, you can see that the a change in the TMJ position. When there is a downward displacement of the TMJ position, the H angle is increased to 100 degrees and the mandible is positioned forward and the lower facial height is also reduced. This indicates class 3 features. So this shows that the H angle, that is the angle that is formed between the F plane, H plane and the PN plane, is reduced in class 2 cases and increased in class 3 cases. What are the landmarks and lines that are basically used? Let's see one by one. The first landmark is the orbital point. The second landmark is the Frankfurt horizontal line that is passing through the orbital in the anterior and the porion point in the posterior. The third landmark is the trichion, which is the hairline and the forehead junction. The fourth landmark is the nasion point, that is the soft tissue nasion. The fifth landmark is the subnasal, which is present at the junction of the anterior nasal spine. The sixth landmark is the soft tissue pogonion. The seventh one will be the soft tissue gnathion, and the anterior portion is divided into 3 parts: the upper 1/3, the middle 1/3 and the lower 1/3. Similarly, when you see the picture, you can see a terminology called the KPF. So this is nothing but the profile field in which the upper lip and lower lip should fall. So from which line to the which line this profile field will come. So it will fall between the perpendicular that is dropped from the orbital and the perpendicular that is dropped from the nasion point. And The angle formed by this perpendicular and the line extending from the subnasal to the gnathon should be around 10 degrees. And both upper lip and lower lip should fall within this field. So this is a T line. Next, we'll see about the gnathometry. When you see this picture as such, it is very confusing. But let's divide this picture into a simple part. So you can see that the line that is bisecting the anterior nasal spine and posterior nasal spine is the SPP. So likewise in the mandible, we have the mandibular plane. So the angle between the SPP and mandibular plane, or rather the area between the SPP and mandibular plane will fall into the gnathometry. So they have categorized it into dentoalveolar region and dental region. You can see that they have measured the inclination of the upper and lower incisors. They have calculated the body of the mandible, ramal height of the mandible. They have measured the width of the maxilla. All that measurements have been carried out and the proportions have been brought about. So these are the angular measurements. You can see that the interincisal angle is around 140 degree plus or minus 10 degrees. The inclination of the upper incisor is around 70 degrees plus or minus 5 degrees. The inclination of the lower incisors is around 90 degrees plus or minus 3 degrees. And the angle between the PN perpendicular and the occlusal plane is around 75 to 77 degrees. So these are the different angles that will fall under the angular measurements. So we'll see one by one. The angle formed between the SPP and the mandibular plane is the basal plane angle. Basal plane angle is usually 20 degrees plus or minus 5 degrees. If it is reduced, then the patient is having a reduced lower facial height. If it is increased, the patient is having an increased facial height. The next is a gonial angle. The angle formed at the angle or the gonial angle or the angle between the ramus and the lower border of the mandible is a gonial angle. It should be around 123 degrees plus or minus 10 degrees. Next is the AB angle. AB angle is nothing but the line angle that is formed by extending the AB line onto the SPP plane. So maxillomandibular plane angle is the angle that is formed in the intersection of the AB line. So the average angles of the upper incisors, like I mentioned previously, upper incisor is around 70 degree plus or minus 5 degrees. The average inclination of the lower incisors is around 90 degree plus or minus 3 degrees. The interincisal angle will fall under 140 degrees. So now let's see the linear measurements. What is the average linear measurement of the anterior cranial base? Usually it should come around 60 to 70 mm. So when the cranial base is between 60 to 70 mm, the length of the mandible should be around plus 3 mm of the length of the anterior cranial base. Likewise, the average length of the ramus is around 50 mm and the average length of the maxilla is around 47 mm. Now let's see about the ratio. When we measure all these four lengths, the ratio of the anterior cranial base to the upper jaw is 10:7. The ratio of the upper jaw to the mandibular base is around 2:3. The ratio of the anterior cranial base to the pogonian-gonian line is 20:21 or 60:63. The ratio of the mandibular body to mandibular ramus is 7:5. The upper incisors and molars to the SPP plane and lower incisors to the molars to the mandibular plane is around 5:4. So next we'll see about the soft tissue thickness. So when we measure the soft tissue thickness, like you can see, we'll measure the thickness of the upper lip at the subnasal region and at the most prominent point of the upper lip. Likewise, the lower lip at the most prominent point and the menton point. So these are the measurements in which the normal skull will fall under. So this is about the Schwarz analysis. Thank you.